I need to tell you something that's been eating at me for years, and the moment I say this out loud, some of my colleagues are going to be very upset with me. But after more than 2 decades in medicine, after watching what happens to people when they follow every recommendation thrown at them, I can no longer stay silent. I'm Dr. Javier, and here's what nobody wants to admit. Sometimes the worst thing you can do for your health is get too many tests, especially after 60 or 65. Now, I can already hear some of you thinking, wait, isn't this doctor supposed to tell me to get checked for everything? Isn't prevention the whole point? And yes, that's exactly what we've all been told. Catch it early. Find it before it becomes a problem. Stay on top of everything. That message is everywhere. But what if I told you that message is leaving out the most important part of the story? The part about what happens after you find something. Because here's what they don't mention in those health screening commercials. Once you find something, anything, even something that would never have hurt you, the wheels start turning. And sometimes those wheels roll right over your quality of life. Today I'm going to walk you through 4 medical tests that I see causing more harm than good, particularly for people over 60. And I'm not doing this to scare you away from doctors. I'm doing this because I want you to understand what you're getting into before you say yes to every test offered to you. Before I get into the specific tests, I need you to understand something that completely changed the way I practice medicine. It's called the cascade effect, and once you see it, you can't unsee it. Here's how it works. You go in for a screening test. Let's say you feel perfectly fine. You're living your life, doing your thing. The test comes back and shows something. Maybe it's a spot. Maybe it's a shadow. Maybe it's a number that's slightly off. Now that thing could be completely harmless. It could have been there for 20 years and could stay there for 20 more without ever bothering you. But here's the problem. The doctor sees it, and now they have to do something about it. Because what if they don't, and it turns out to be serious? So you get sent to a specialist. The specialist orders another test, a more detailed one. That test maybe shows the same thing, still not clear. So now we're talking about a biopsy, a procedure, maybe even surgery. And every single one of those steps carries risks. Infection, bleeding, complications, anxiety, lost time. And here's the most frustrating part. When you get to the end of all of it, 9 times out of 10, you find out it was nothing. It was never going to hurt you. But now you've spent months worrying. You've had procedures done. Maybe you've had complications. And you are worse off than when you started, all because of a test you possibly never needed. That is the cascade, and it starts with a single test you maybe never needed in the first place. So let's talk about the first test I see causing this problem over and over again. And this one is tricky because it sounds so smart, so modern, so preventive. I'm talking about whole body scans, full body MRIs or CT scans that promise to check everything at once. You've probably seen the ads. Come in, we'll scan you head to toe, detect anything before it becomes a problem. Sounds incredible, right? Like getting a complete picture of everything happening inside you. And I understand the appeal, I really do. The idea of knowing everything, of having control, that is incredibly attractive. But here's what actually happens. Let's say you're 65. You feel good. You're active. You have no symptoms of anything. You decide to get one of these scans just to be sure. You go in, lie in the machine for 30 minutes, and a couple days later you get your results. And right there in the report, the radiologist mentions something. A tiny 3-millimeter nodule in your lung, about the size of a pencil eraser. Or maybe a cyst on your kidney. Or a spot on your liver. The report says, follow-up imaging recommended in 3 to 6 months. How do you feel in that moment? You walked in feeling healthy and walked out being told there's something in your body that needs watching. You probably can't think about anything else. Every time you take a deep breath, you think about that lung nodule. Every time you feel something in your side, you think about that kidney cyst. So 3 months later, you go back for another scan. Maybe the thing is still there. Maybe it's a tiny bit bigger, hard to say. The radiologist recommends seeing a specialist. The specialist wants to be thorough, so they recommend a biopsy. And a biopsy is no small thing. It means going under anesthesia. It means a needle into your lung, your kidney, wherever this thing is. It means risk of infection, risk of bleeding. And here's what the research shows. When you scan healthy people over 60, you find something unusual in almost all of them. I'm not exaggerating, we're talking 90 to 95% of people. Tiny spots, small cysts, little shadows. The medical term for these is incidentalomas, things we find incidentally. And the vast majority of them will never cause a problem. They are simply part of having a body that has been around for 6 or 7 decades. They are like wrinkles on the inside. But once we find them, we cannot ignore them. And that is when the cascade begins. There is actually research on this. They followed people who got these whole body scans. And you know what they found? The people who got scanned did not live longer than those who didn't. They didn't avoid any disease, but they did have significantly higher rates of anxiety, depression, and unnecessary procedures. The scans didn't make them healthier, they made them sicker. So what should you do instead? This is important because I'm not saying ignore your health. I'm saying pay attention to the right things. Instead of getting a picture of your insides, focus on how your body actually functions. Can you climb 2 flights of stairs without getting winded? Can you get up from a chair without using your hands? How is your balance? How is your sleep? These functional measures tell us far more about your health than any scan. If you want a real health checkup, sit down with a doctor who takes time with you. Someone who reviews every medication you're taking, because I guarantee at least one of them is probably doing more harm than good. Someone who talks with you about your diet, your activity level, your social connections, because those everyday, unglamorous things are what actually determine how healthy you are. The scan looks for problems that might not exist. The functional assessment optimizes the health you already have. Big difference. Now let's move to the second test, and this one affects a lot of people because it touches the fear we all have about getting older. I'm talking about getting a brain MRI for mild memory concerns. Here's the scenario. Maybe you're in your early 70s and you've noticed you sometimes can't remember the name of that actor you like, or you walk into a room and forget why you went. Normal things, the kind of things that happen to everyone as they age. But maybe your children are worried. Maybe they've heard about Alzheimer's and they're scared, so they push you to get a brain scan just to check. And I understand that fear, I really do. Nobody wants to think about losing their memory, about losing themselves. But I need you to understand this. Getting a brain MRI for mild forgetfulness is almost never helpful, and it is frequently harmful. Because here's what happens. You get the MRI, and a few days later you're sitting with your doctor reading the report. And the report says things like mild brain atrophy, age-related changes, white matter lesions, small vessel disease. Those words sound terrifying. They sound like your brain is deteriorating. But here is the truth. Those findings are completely normal for someone in their 70s. They are describing what every brain looks like at that age. It's like scanning your skin and being surprised it shows wrinkles and age spots. Of course it does. That's what skin looks like at 75. The problem is that medical terminology doesn't sound normal. It sounds like disease. And suddenly you're walking around thinking you have brain damage, thinking Alzheimer's is right around the corner, even though you're fine. Studies show that when you scan the brains of healthy people over 75, more than 90% have findings that look abnormal on the report. More than 90%. But most of those people have perfectly normal memory and thinking. The image doesn't match reality. I've seen razor-sharp people, reading books, managing their finances, doing crosswords, whose MRI looks terrible. And I've seen people with early dementia whose MRI looks fairly normal. The image is not telling us what we think it is. So what should you do instead? If you're worried about memory, there is a much better way to assess it. There are simple tests we can do right in the office, tests that take 10 minutes. We ask you to remember 3 words, draw a clock, count backward from 100 by sevens. Simple things that actually measure how your brain is functioning, not just what it looks like. And if those tests show a problem, then we start looking for causes. And here's the thing. Most causes of memory problems in older adults are reversible. It could be a medication causing confusion. It could be low vitamin B12. It could be depression, which frequently shows up as memory problems in older people. It could be sleep apnea cutting oxygen to your brain at night. It could be a thyroid issue. We check all of those things first, and you'd be surprised how often fixing just one of them brings the memory back. No MRI needed. We look at function, not images. We treat the person, not the picture. Now, if someone is progressively getting worse, getting lost in familiar places, no longer able to manage their money, that is different. That warrants a full evaluation, including imaging. But for the everyday forgetfulness that comes with age, a brain MRI creates more problems than it solves. The third test on my list surprises people because it seems so logical. I'm talking about cardiac stress tests, specifically putting someone on a treadmill just because they've reached a certain age. Here's the typical situation. Maybe you're 72 and you're about to have routine surgery. Nothing major, maybe a hernia repair or a knee replacement. And the hospital protocol says everyone over 70 needs a cardiac stress test before surgery. So even though you feel fine, even though you can walk a couple of miles without chest pain or shortness of breath, they put you on a treadmill. Think about this for a moment. If you can walk 2 miles in your daily life without any trouble, what exactly is the treadmill test going to tell us that we don't already know? Your daily life is your stress test. You're already passing it every day. But the protocol is the protocol, so you get on the treadmill. And here's where it gets complicated. Stress tests have very high false positive rates in older adults. That means the test says something is wrong when it actually isn't. It could be because your heart rate doesn't climb the way it used to. It could be because of medications you're on. It could be any of 100 reasons that have nothing to do with a dangerous blockage. But once that test comes back abnormal, you're on the medical conveyor belt. They schedule a cardiac catheterization, where they insert a tube through an artery all the way to your heart to look at the blood vessels. It's invasive, it has risks, and often when they get there they find exactly what you'd expect in a 72-year-old heart. Some plaque buildup, some narrowing, but nothing requiring surgery. Nothing that was about to cause a heart attack. But now you've been through an invasive procedure, and worse, you've been labeled a cardiac patient. They put you on a bunch of new medications, and the psychological damage is done. Maybe you used to play tennis, but now you're afraid to exert yourself. The test that was supposed to protect you has stolen your confidence and your activities. So what's the alternative? Listen to your body. That is the best stress test there is. If you can climb stairs, if you can walk at a good pace, if you can do your normal activities without chest pain or unusual breathlessness, you are telling us your heart is doing its job. Those are the symptoms to watch for. Chest discomfort with exertion, unusual shortness of breath, dizziness. If you have those, yes, absolutely get checked. That's when a stress test makes sense. But if you want to know your future risk, there's a much better tool. It's called a coronary calcium score. It's a quick scan, takes 5 minutes, no treadmill, no needles, very little radiation. It measures how much calcium, essentially hardened cholesterol, is in your arteries. The result is a number. 0 means very low heart attack risk over the coming years. A high number means you need to get serious about prevention through diet, exercise, possibly medication. But here's the key difference. The calcium score tells you your risk, guides prevention. It doesn't automatically send you down the path of invasive procedures. It gives you information so you can make decisions, not anxiety that forces you into procedures. Don't let them put you on a treadmill just because of your age. Trust what your body is already telling you every single day. Now we get to the fourth test, and I know this one is going to be controversial. I'm talking about colonoscopies after age 75, specifically routine screening colonoscopies when your previous ones have been normal and you have no special risk factors. Let me be very clear here. I am not against colonoscopies. They are a fantastic tool. I recommend them starting at 45 or 50. They prevent colon cancer by allowing us to remove polyps before they become cancer. If you're 50, 60, or in your early 70s and one is due, please get it done. But here's the thing. Every medical test is a balance between benefit and risk, and that balance shifts as we age. The benefit of a colonoscopy is preventing a cancer that, if it develops, takes 5 to 10 years to cause problems. But if you're 78 or 80, does that benefit still outweigh the risks? Because colonoscopies do carry risks, and those risks increase with age. There's the PrEP, drinking that terrible liquid that keeps you in the bathroom all night, which can leave an older person dehydrated and weak. There's the sedation, which in older adults carries a higher risk of confusion or breathing problems. And there's the biggest one, the one that worries doctors most, perforation, a tear in the wall of the colon. As we age, the colon wall thins. The risk of the scope accidentally tearing it roughly doubles or triples after age 75. And a perforation is a surgical emergency. It often means emergency surgery. Sometimes it ends with a colostomy bag. For an 80-year-old, that kind of operation can mean the end of independent life. Now weigh that against the benefit. You're trying to prevent a cancer that would take years to become a problem. If your life expectancy is less than 10 years, the math doesn't work. The colonoscopy is more likely to cause you harm than save you. That's why most medical guidelines now say to stop routine screening somewhere between age 75 and 85. This isn't one size fits all. If you have a family history of colon cancer, if you've had polyps before, if you have inflammatory bowel disease, that's a different calculation. But for the average person with no special risk, continuing to get colonoscopies every 5 to 10 years past 80 is probably doing more harm than good. So what do you do instead? Just ignore your colon? Absolutely not. You shift from invasive screening to smart awareness. Pay attention to symptoms. This is crucial. If you notice persistent changes in your bowel habits, if you see blood in your stool, if you have unexplained abdominal pain or weight loss, if you develop anemia, those are red flags. At that point, age doesn't matter. You need a colonoscopy to find out what's going on. And use the power of diet. This is huge. The single best thing you can do for your colon is eat fiber, fruits, vegetables, legumes, whole grains. Fiber feeds the good bacteria in your gut, and those bacteria produce substances that protect against inflammation and cancer. More lentils, more broccoli, more oats, more apples. That is prevention that benefits your entire body with zero risk. The message is, get your colonoscopies when they make sense, through your early 70s. After that, for most people, it's time to shift to watching for symptoms and eating the right foods. So there you have it, 4 tests I see causing more harm than good, especially after 60. Whole body scans that find problems that aren't problems. Brain MRIs for normal forgetfulness that create abnormal anxiety. Routine stress tests that trigger cascades of procedures. And colonoscopies past 75 that risk more than they prevent. Notice the pattern? It's all about the cascade. One test leads to another, leads to another, leads to a procedure, leads to a complication. And somewhere along the way we forget to ask the most important question. Is this person actually better off? Because here is what I've learned in 22 years of medicine. Health is not about having perfect test results. Health is about function. It's about being able to do the things you want to do. It's about enjoying your grandchildren, taking a walk, reading books, living your life, without fear and without unnecessary medical interference. The goal at 65, 70, or 80 is not just to live longer, it's to live better, with independence, with dignity, with joy. And sometimes the best way to protect that is to say no to a test that will pull you into a maze you don't need to enter. I'm not saying avoid all medical care. I'm saying be a smart patient. Ask questions. When a doctor recommends a test, ask why. Ask what happens if the test finds something. Ask what the risks are. Ask whether there's an alternative. Then make a decision based on what matters to you. You are in charge of your health, not the protocols, not the computer reminders, not the clinical guidelines. You. And the more you understand about what you're agreeing to, the better decisions you'll make. If this gave you a new way of thinking about medical testing, do me a favor and share it with someone who needs to hear it. Subscribe if you want more honest conversations about health and medicine, because I'm going to keep having them. And tell me in the comments, have you ever felt pushed into a medical test that didn't feel right to you? I read every comment, and I learn from your experiences just as you learn from mine. Thank you for watching. Take care of yourselves. And remember, sometimes the healthiest thing you can do is nothing at all.